Hi students, today I am going to deal the topic dialysis from the chapter blood pressure and blood flow measurement and therapeutic instruments. Hi students, today I am going to deal the topic blood pressure from the chapter blood pressure and flow measurement and therapeutic instruments. The topic dialysis. Learning objectives. Upon completion of this presentation, you will be able to understand the concepts of dialysis, the importance of dialysis, hemodialysis, construction and working of hemodialysis, advantages and disadvantages of hemodialysis. Upon completion of this presentation, you will be able to understand what is the concepts of dialysis, importance of dialysis, hemodialysis, construction and working of hemodialysis, advantages and disadvantages of hemodialysis. Before understanding the concepts of dialysis, let me tell you where we use this dialysis. Before knowing the concept of dialysis, you must understand the working of our kidneys. What are kidneys and their working principle? Kidneys are two bean-shaped organs, each about the size of a fist. Kidneys are two bean-shaped organs, each about the size of a fist. They are located just below the rib cage, one on each side of the spine. They are located just below the rib cage, one on each side of the spine. Kidneys are two bean-shaped organs, each about the size of a fist. They are located just below the rib cage, one on each side of the spine. Healthy kidneys filter about a half cup of blood every minute. Healthy kidneys filter about a half cup of blood every minute, removing waste and extra water to make urine. Healthy kidneys filter about a half cup of blood every minute, removing waste and extra water to make urine. The urine flows from the kidneys to the bladder through two thin tubes of muscles called ureters, one on each side of the bladder. The bladder stores the urine. So you have the two bean-shaped organs that are the kidneys. The urine flows from the kidneys to the bladder through two thin tubes of muscles called ureters, one on each side of the bladder. The bladder stores the urine. The kidneys, the ureters and the bladder are part of the urinary tract. They are the part of the urinary tract. So you can observe the kidneys location in our body, how they look like. So they are two bean-shaped kidneys organs, and the kidneys filter out about half cup of blood every minute, removing waste and extra water to make urine. The urine flows from the kidneys to the bladder through two thin tubes of muscles called ureters, one on each side of the bladder. So the bladder stores the urine. So the kidneys, the ureters and the bladder are part of the urinary tract. They are the part of the urinary tract. Why are kidneys very important? So important. You should know the importance of kidneys, then we can know the importance of dialysis. So the main function of the kidneys is to remove waste and extra fluid from our body. They remove waste and extra fluid from our body. Kidneys also remove acids that is produced by the cells of our body and maintain a healthy balance of water, salts and minerals such as sodium, calcium, phosphorus and potassium in our blood. Without this balance, nerves, muscles and other tissues also may in our body may not work normally. So what do the kidneys do? Kidneys remove the waste and extra fluid from our body. The kidneys also remove acids that are produced by the cells of our body, and they maintain a healthy balance of water, salts and minerals such as sodium, calcium, potassium and phosphorus in our blood. Without this balance, nerves, muscles and other tissues in our body may not work normally. Without this balance, the nerves, the muscles and other tissues in our body may not work normally. So kidneys also make hormones that help control our body blood pressure, make red blood cells, keep our bones strong and healthy. So kidneys, they also make hormones that help control our blood pressure, make red blood cells, keep our bones strong and healthy. So these are the various functions of the kidneys. How do my kidneys work? Kidneys remove so each of our kidney is made up of, anyone's kidneys are made up of a million of filtering units called nephrons. They are made up of millions of filtering units called nephrons. Each nephron includes a filter called glomerulus and a tubule. So each nephron includes a filter. So kidneys are made up of millions of filtering units called nephrons. And each nephron includes a filter. It includes a filter called the glomerulus and a tubule. The nephrons work through a process, two-step process. It is the glomerulus filters your blood and the tubule returns needed substances to your blood and removes waste. So each nephron has a glomerulus. What does the glomerulus do? It filters your blood. And what does the tubule do? The tubule returns the needed substances to your blood and pulls out additional waste. The waste and extra water, it converts into urine. Okay. So each nephron has a glomerulus and a tubule. So the glomerulus, it filters your blood. The tubule returns needed substances to your blood and removes the waste. It pulls out the additional waste. It returns needed substance to your blood and it pulls out, what does it pull out? It pulls out the additional waste, and this waste and extra water becomes urine. It becomes urine. So this is what the kidneys work. How do kidneys work? So as I told you, blood flows into each nephron. So what does kidney consists of? It consists of large number of nephrons, and each nephron, it has a glomerulus and a tubule. So as blood flows into each nephron, it enters a cluster of tiny blood vessels called the glomerulus. The thin walls of the glomerulus allow small molecules, waste and fluids, mostly water, to pass into the tubule. Larger molecules such as protons and blood cells stay in the blood vessel. They stay in the blood vessel. So the blood flows into each nephron. It enters a cluster of tiny vessels, the glomerulus. The thin walls of the glomerulus, what does they do? They allow smaller molecules, the thin walls, they allow smaller molecules, waste and fluid, mostly water, to pass into the tubule. Larger molecules such as proteins and blood cells stay in the blood vessel. Then the next stage is the tubule. It returns needed substances to your blood and removes the waste. So a blood vessel runs alongside the tubule. As the filtered fluid moves along the tubule, the blood vessel reabsorbs almost all of the water along with the minerals and nutrients into as your body needs. The tubule helps remove excess acid from the blood. The remaining fluid and waste in the tubule becomes urine. So the blood vessel runs alongside the tubule. As the filtered fluid moves along the tubule, the blood vessel reabsorbs almost all of the water along with the minerals and nutrients into your body needs. The tubule helps remove excess acids from the blood. The remaining fluid and waste in the tubule becomes urine. It becomes urine. So, how does blood flow through kidneys? Blood flows into the kidneys through the renal artery. This large blood vessel branches into smaller and smaller blood vessels until the blood reaches the nephrons. In the nephron, your blood is filtered by the tiny blood vessels of the glomeruli and then flows out of your kidney through the renal vein. They enter through the renal artery. After purification, after it is filtered, then they go out through the renal vein. Your blood circulates through your kidneys many times a day. So, blood circulates through the kidneys many times a day. In a single day, your kidney filters about 150 quarts of blood. Most of the water and other substances that filter through your glomeruli are returned to your blood by the tubules. The water and other substances that filter through your, they are returned back to the blood by the tubules. Only 1 or 2 quarts become urine. Out of 150 quarts of blood, all the unwanted material is being filtered out and only 1 or 2 quarts become urine. The remaining, they go back into the blood after purification. So, this is all the process that is taking place in our body, the natural process. The kidneys, what do? Their main function is to form urine out of the blood plasma. They remove off all the waste products in the blood plasma and regulate the composition of blood plasma. These are the activities or the functions of the kidney. So, how does blood flows through the kidney? This is the picture how it flows. You can see there blood with the waste. It enters through the renal artery. Blood containing all the contaminated things, they enter through the renal artery into the kidney. Blood flows into the kidneys through the renal artery. And after filtration, after the glomerular, what does it do? The glomerular, after the blood in the nephrons, the blood is filtered by the tiny blood vessels of the glomeruli, and then the purified blood flows out of the kidneys through the renal vein. It flows out of the kidney through the renal vein. And the unwanted waste or the unwanted material, it is sent to the bladder as urine. It is sent to the bladder as urine. And the filtered blood is sent through renal vein. The filtered blood, after it is passed through the kidney, it gets filtered out. That filtered out blood comes out through the renal vein. So, this is the structure of how the blood flows through the kidneys, into the kidneys and out of the kidneys. So, during this process, changes in the body fluids in renal diseases. In the case of renal diseases, what are the changes that can be observed in the body fluids? Like for example, the renal malfunction known as uremia, where most urinary contents are water soluble, they reach to higher concentrations in the blood and result in dearranged body parts. They result in dearranged body parts and their physiology. Because of malfunctioning of the renal problem, renal malfunction known as uremia, where most urine contents are water soluble, they reach to higher concentrations in the blood and which results in deranged body parts. Acute renal failure are characterized by virtual cessation of urine formation. Virtually the urine begins to stop. The kidney cannot avert any appreciable excretory or regulative. What is the purpose of the kidney? To do excretory function and also to do regulatory function. That cannot be done. Then the nitrogenous waste products, when retained in the blood plasma, when the kidneys are not functioning properly, what happens? The nitrogenous waste products, they will be retained in the blood plasma, which results in progressive rise in their level in the plasma, progressive rise in their levels in the plasma. Progressive rise in their levels in the plasma. So, when the nitrogenous waste products, when they are retained in the blood plasma, it results in progressive rise in their level in the plasma. So, what happens? Dangerous changes in the volume and distribution of the body water may also occur in acute renal failure. In acute renal failure, the volume and distribution of the body water may reach the dangerous levels. A patient with chronic renal failure is liable to develop either deficiency or excess of body fluid. Either deficiencies or excess of body fluid, water and sodium, due to decline in the number of functioning nephrons, because of which the kidneys become less effective as a regulatory organ. So, a person suffering with chronic renal failure is liable to develop a deficiency or excess of body fluid, water and sodium due to decline in the number of functioning nephrons, because of which the kidney becomes less effective as a regulatory organ. So, the need arises. What to do? How to filter out this excess nitrogenous body waste? So, an artificial process of eliminating the waste, diffusion and unwanted water ultrafiltration from the blood, which our kidneys do it naturally, is required. So, the naturally processing elements, the naturally processing kidneys, if they are not functioning, so an artificial process of eliminating waste and unwanted water from the blood, which our kidneys do this naturally, is required. There arises an requirement. The requirement is you need to go for some artificial method or artificial process of eliminating the waste from the blood. So, the concept of dialysis now comes into picture. What is dialysis? What is its importance? When we diagnose, a diagnosis of kidney disease means that a person's kidneys are damaged and cannot filter blood the way they should. This damage can cause waste to build up in our body. Suppose the kidneys are not functioning, so the kidneys are having you are having kidneys disease, then the kidneys are damaged and cannot filter blood. This damage can cause waste to build up. They cause waste to build up in the body. Kidney disease can cause our health problems such as heart disease. If you have a kidney disease, it increases your chances of having a stroke or heart attack. It can cause healthy problems, other health problems such as heart diseases. Major risk factors for kidney diseases include diabetes, high blood pressure and family history of kidney failures. So, the dialysis is used to filter waste and water from the blood. So, other risks like kidney diseases include diabetes, high blood pressure and family history of kidney failures All these are the major risk factors for kidney diseases. The dialysis is used to filter out the waste and water from the blood. So when their kidneys fail, people need to filter their blood artificially. So a dialysis process is utilized to filter the blood artificially, to filter out the blood artificially. When your kidneys can't perform the excretory and regulatory function due to disease or injury, dialysis can help keep the body running as normal as possible. So, dialysis will help to keep your body functioning as normal as possible if your kidneys can't perform the excretory and regulatory functions. Without dialysis, salts and other waste products will accumulate in the body. They accumulate in the blood, poison the blood and damage other organs. So without dialysis, what happens if you're not going for the process of dialysis? These salts and waste products, they will accumulate in the blood and poison the body and damage the other organs, and they damage the other organs. So dialysis performs the function of the kidneys if they have failed. They perform the function of the kidneys if they have failed. Dialysis is a treatment that filters and purifies the blood using a machine. This helps keep our fluids and electrolytes in balance when the kidneys can't do their job. Okay, dialysis performs the function of the kidneys if they have failed. They perform the function of the kidneys if they have failed. Dialysis is a treatment that filters and purifies the blood using a machine. By using a machine, they will filter and purify the blood. This helps keep our fluids and electrolytes in balance when the kidneys can't do their job. So dialysis is the artificial process of eliminating waste and unwanted water from the blood. Eliminating waste by the process of diffusion and unwanted water, that is ultrafiltration, from the blood. Types of dialysis. There are 3 different types of dialysis. They are hemodialysis, peritoneal dialysis, continuous renal replacement therapy, CRRT. It is called as CRRT. There are 3 different types of dialysis: hemodialysis, peritoneal dialysis, continuous renal replacement therapy. Hemodialysis. Hemodialysis is the most common type of dialysis. This process uses an artificial kidney, HEMODIALYSER, to remove waste and extra fluid from the blood. The blood is removed from the body and filtered through the artificial kidney. Artificial kidney is nothing but hemodialyzer. The filtered blood is then returned to the body with the help of dialysis machine. There are 3 methods that are utilized for doing this dialysis. Hemodialysis method. In the hemodialysis method, this is the most common type of dialysis. In this process, they use an artificial kidney, that is hemodialyzer, to remove waste and extra fluid from the blood. The blood is removed from the body and filtered through the artificial kidney. The blood is removed from the body and filtered through the artificial kidney. The filtered blood is then returned to the body with the help of a dialysis machine. The second method is peritoneal method. Peritoneal dialysis. What is this peritoneal dialysis? Peritoneal dialysis involves surgery to implant a peritoneal dialysis catheter into your abdomen. A peritoneal catheter is inserted into it is implanted into your abdomen. So you need a surgery. The catheter helps filter your blood through the peritoneum, a membrane in your abdomen. During treatment, a special fluid called dialysate flows into the peritoneum. The dialysate absorbs the waste. Once the dialysate draws waste out of the bloodstream, it is drained from your abdomen. This is called peritoneal dialysis. So you need a surgery here to implant a peritoneal dialysis catheter into your abdomen. Then the third method is continuous renal replacement therapy. Continuous renal replacement therapy. This therapy is used primarily in the intensive care unit for people with acute kidney failure. This is mostly used by people who are having acute kidney failure. It is also known as hemofiltration. Continuous renal replacement therapy is also known as hemofiltration. A machine passes the blood through tubing. A filter then removes waste products and water. The blood is returned to the body along with the replacement fluid. So this procedure is performed for 12 to 24 hours a day, generally every day. From 12 to 24 hours a day it is done. From 12 to 24. That's why it's called continuous renal replacement therapy. Hemodialysis. So we are very particular with the hemodialysis. In our topic of discussion, we are going to discuss about hemodialysis. The first method, the hemodialysis method. So the hemodialysis method is the most common method, as I told you. This process uses an artificial kidney, that is hemodialyser, to remove the waste and extra fluid from the blood. The blood is removed from the body and it is filtered, and extra fluid from the blood. It is filtered to remove waste and extra fluid from the blood through the artificial kidney. The filtered blood is then again returned to the body with the help of a dialysis machine. Okay. So the hemodialysis machine, it performs 5 basic functions. The 5 basic functions which are performed by the hemodialysis machine are: mixes the dialysate, monitor the dialysate, it pumps the blood and controls administration of anticoagulants, monitors the blood for presence of air and rift chamber pressures, monitors the ultrafiltration rate. These are the 5 basic functions of the hemodialysis machine. It mixes the dialysate, it monitors the dialysate, it pumps the blood and controls administration of anticoagulants, monitors the blood for the presence of air and rift chamber pressures, and it monitors the ultrafiltration rate. So principle of hemodialyser. Artificial kidney or hemodialyser, it works on the principle of dialysis, which is the diffusion of small solute molecules through a semi-permeable membrane. You are going to use the process of diffusion of small solute molecules through a semi-permeable membrane. So blood is removed from the body and it is pumped by a machine outside the body into a dialyzer. So blood is removed from the body, it is pumped by a machine outside the body, that is a dialyzer. So it is called as artificial kidney. So this dialyzer replaces the working of the kidney. So the dialyzer, what does it do? It does filters metabolic waste products from the blood and returns the purified blood to the person. The amount of fluid returned can be adjusted. A person typically undergoing hemodialysis at a dialysis center undergoes hemodialysis at a dialysis center. It cannot be done at your home. Hemodialysis will be undergoes a hemodialysis at a dialysis center. Dialysate is a solution used by the dialyzer. Dialysate is a solution that is used to wash off the unwanted waste from the blood. Okay, so when we look at the picture of the hemodialyzer, you can understand. So here is a picture of a hemodialyzer. The hemodialyzer, so we have two. You are taking the blood from the artery and it is pumped. The blood is sucked from the artery and it is pumped into the dialyzer unit, which consists of a membrane. Series of membranes are there. So when the blood passes through the membrane and a fresh dialysate which is compressed air is used to pump this dialysate into this dialyzer. So the fresh dialysate is introduced into the dialyzer and the blood gets purified there. The unwanted waste materials are removed and purified blood is sent back through the tube into the vein. So this is the principle of hemodialyzer. So HD stands for hemodialyzer, consists of perfusions of heparinized blood and physiologic salt solution on the opposite sides of the semi-permeable membrane. Waste products like urea and creatine moves from the blood into the dialysate by passive diffusion along concentration gradient. Because of the concentration gradient, due to the diffusion process, urea and creatine will be moved off from the blood. So diffusion rate depends upon the solute concentration in the blood and the dialysate. Solute characteristics. It depends on the dialysis filter composition. It depends on the blood and dialysate flow rate. It depends on the blood and dialysate flow rate. So this is your dialyzer unit. You can see in the dialyzer unit, from the top, dirty blood enters into the dialyzer. Dirty blood enters into the dialyzer. So the membrane contains, you can see the vertical lines there, that is the membrane. It contains your blood which is dirty blood that is coming into the dialyzer. Each membrane has tiny holes that the waste can move out of, but the important things like blood cells and proteins stay inside the membrane. Important blood cells and proteins stay inside and the waste can be moved out. It can be moved out. So clean fluid, that is the dialysate, enters the dialyzer from the bottom and surrounds each membrane, cleaning your blood as it travels up the dialyzer. So when it moves up, clean blood is returned back to your body. So dirty fluids are containing the waste from your blood goes to the drain. So when this clean fluid is pushed into the membrane, what happens? These dirty components or unwanted wastes are removed. Tiny holes that the waste can move out of, but blood cells and proteins stay inside the membrane. So these will be coming out as clean blood is returned back to your body. After dialysis, after the entire cleaning process is taking place in the dialyzer, the dirty blood which enters into the dialyzer unit, it is washed off by the clean dialysate fluid which enters the dialyzer and surrounds each membrane, cleaning your blood as it travels up the dialyzer. So dirty fluid, that is the dialysate containing the waste from your body, goes out to the drain and leaving behind clean blood is returned back to your body. Clean blood is returned back to your body. So the working of hemodialysis. In hemodialysis, blood is allowed to flow a few ounces at a time through a special filter that removes waste and extra fluids. It removes waste and extra fluids. The clean blood is then returned to the body, removing the harmful waste and extra salts and fluids helps control the blood pressure and keep the proper balance of the chemicals like sodium and potassium in the body. The vascular access should be prepared weeks or months before starting the dialysis. Before starting, it should be well prepared for hemodialysis. So it will allow easier and more efficient removal and replacement of the blood with fewer complications. In the hemodialysis process, you will be able to easily and more efficiently remove and replacement of blood with fewer complications. The dialyzer is a large canister containing thousands of small fibers through which the blood is passed. As I showed you, the dialyzer, it is a membrane which contains large number of membranes containing thousands of small fibers through which blood is passed. So dialysis solution, the cleansing fluid is pumped around these fibers. The fibers allow waste and extra fluids to pass from the blood into the solution which carries them away. So the dialyzer is sometimes called as an artificial kidney. That's why it is called as an artificial kidney. This is the hemodialysis process. Once again, we can see the blood from the vein. It is taken out and it is pumped into the dialyzer unit by after controlling of pressure and preventing from clotting. You are going to use heparin, anticoagulant agent, which is used to prevent the clotting of blood after it is taken out of the body. So this blood is pumped into the dialyzer. The dialyzer is the filter which filters the it is an artificial filter. It filters, it consists of membranes, fibers. So what is happening? The blood containing the unwanted waste material is filtered out through these membranes through the process of diffusion and ultrafiltration, and pure blood is pumped into the body and it is returned after filtration into the body through the vein, renal vein. Blood is tapped from the renal artery and it is given into the renal vein. So this is the working principle of a hemodialysis machine. It is a working principle of hemodialysis machine. Then the advantages and disadvantages of hemodialysis. Hemodialysis is an effective treatment for those with end stage renal diseases. Okay, it is an effective treatment. It is an effective treatment for those who are suffering with renal disease in the end stage. However, hemodialysis alone will not provide a complete treatment for those with kidney failure. Those who are with kidney failure, renal hemodialysis alone cannot be a complete treatment. And the disadvantages in this hemodialysis is diet and fluid restrictions need to be followed. Diet and fluid restrictions need to be followed, and medicines may need to be taken to replace other functions of the kidney, such as regulating blood pressure and stimulating production of red blood cells to prevent anemia. Okay, so medicines must also be used. In addition to dialysis process, you have to use medicines for regulating the blood pressure and for stimulating production of red blood cells and to prevent anemia. So the diet restrictions are very essential in this case. Diet restrictions include limiting foods that contain phosphorus, potassium and sodium, and drinking a limited amount of fluid. So these are the disadvantages, and they will have to travel. The patients who are undergoing hemodialysis, they will have to travel from for 3 times each week, and it takes advance notice to travel or arrange for dialysis in a visiting dialyzing center. They must take an advance booking, or they must travel to the dialysis center for dialysis. So these things are some of the disadvantages. So hemodialysis, it is an effective treatment for those who are with end stage renal diseases, but there are some complications, some limitations also, like the hemodialysis alone will not provide a solution, complete treatment for those with kidney failure. If the kidneys are totally failure, it is not only a solution, you should do something else also. And diet and fluid restrictions need to be followed, and during this diet and fluid restrictions, like you have to limit the intake of some minerals like phosphorus, potassium and sodium, and drink a very limited amount of fluid. And medicines may need to be used for other problems such as regulating blood pressure, stimulating production of red blood cells to prevent anemia. Then the diet, they will have to, and patients who are suffering with hemodialysis, they have to go for the treatment three times a week. So advance notice to travel and arrange for dialysis in the visiting dialyzing centers must be made well in advance. So these are the disadvantages and advantages of hemodialysis. So to summarize our topic of discussion, or the topic of discussion today, we have understood the concepts of dialysis. Actually we have understood the working of kidneys, the main function of the kidneys. Kidneys are two bean-shaped organs, each about the size of the fist, and a healthy kidney can filter about half a cup of blood every minute, removing waste and extra water to make urine. Urine flows from the kidneys to the bladder through the ureters, and the bladder stores the urine. So the kidneys, the ureters and the bladder are parts of the urinary tract. Each kidney is made up of millions of filtering units called nephrons, and each nephron includes a filter called glomerulus and a tubule. So glomerulus filters your blood, and the tubule returns needed substances to your blood and removes waste. So blood flows into each nephron. It enters a cluster of tiny blood vessels. The thin walls of the glomerulus allow smaller molecules, waste and fluid, mostly water, to pass into the tubule, and the larger molecules such as proteins and blood cells stay within the blood vessel. The blood vessel again runs along the side of the tubule. As the filtered fluid moves along the tubule, the blood vessel reabsorbs almost all of the water along with the minerals and the nutrients in your body needs. The tubule helps remove excess acids from the blood. The remaining fluids and waste in the tubule becomes urine. So blood flows into your kidney through a renal artery. This large blood vessel consists of number of nephrons, and in the nephrons, blood is filtered by the tiny blood vessels of the glomeruli, and then it flows out of the kidney through the renal vein. So your blood circulates through the kidney many times a day. In a single day, the kidney filters about 150 quarts of blood. Most of the water and other substances filter out through the glomeruli and are returned back into the blood. Only 1 to 2 quarts become urine. So the renal malfunctioning results in high concentration of certain components in the blood, which causes sometimes acute renal failure. Is characterized by virtual cessation of urine formation. This nitrogenous waste products, when retained in the blood plasma, results in progressive rise in their levels, and because of the rise in the levels, the dangerous changes in the volume and distribution of the body may occur, in acute renal failure. So an artificial process, that what happens, a patient who is suffering with chronic renal failure, he is liable to develop either deficiency of the excess body fluid, water and sodium, due to decline in the number of functioning nephrons, because of which the kidneys become less effective as a regulatory organ. An artificial process of eliminating this waste and unwanted water from the blood, which our kidneys do this naturally, is required. So a requirement arises. So to avoid all these risks, so people needs dialysis to filter out their blood artificially. So when your kidneys cannot perform the excretory and regulatory function due to disease or injury, dialysis can help people keep their body running as normal as possible. Without dialysis, salts and other waste products will accumulate in the blood, poison the blood and damage the other organs also. So the removal of waste is essential. Removal of waste products from the body which accumulates in the body and they become toxic, they poison the body and damage the other organs. So removal is compulsory. So this dialysis performs the function of kidneys if they have failed. So it is a treatment that filters and purifies the blood using a machine. This helps to keep our fluids and electrolytes in balance when the kidneys can't do their job. So dialysis is an artificial process of eliminating waste, diffusion and unwanted water by ultrafiltration from the blood. We have studied about the three different types of dialysis: hemodialysis, peritoneal dialysis and continuous renal replacement therapy. Hemodialysis is the most common type of dialysis. In this process, where we use an artificial kidney, that is a hemodialyzer, to remove the waste and extra fluid from the blood. The blood is removed from the body and it is filtered through the artificial kidney. The filtered blood is then again returned back to the blood with the help of dialysis machine. Whereas the peritoneal dialysis involves a surgery where you are going to implant a peritoneal dialysis catheter into your abdomen. The catheter helps filter the blood. It is nothing but a membrane. During the treatment, a special fluid called dialysate will be allowed to flow into the peritoneum and the dialysate absorbs all the waste. Once the dialysate draws waste out of the bloodstream, it's drained from your abdomen. Then the continuous renal replacement therapy is used primarily in the intensive care unit for people with acute kidney failure, those who are suffering with acute kidney failure. It is also known as hemofiltration. So a machine passes the blood through a tubing, a filter, then removes the waste products and water. The blood is again returned back to the body along with replacement fluids. So hemodialysis machine, it performs 5 basic functions. What does it do? It mixes the dialysate, it monitors the dialysate, it pumps the blood and controls administration of anticoagulants, then monitors the blood for presence of air and drift chamber pressures and monitors the ultrafiltration rate. So the principle of hemodialysis is artificial kidney or hemodialyzer works on the principle of dialysis, which is the diffusion of small solute molecules through a semi-permeable membrane. Blood is removed from the body and pumped by the machine outside the body into a dialyzer called artificial kidney. The dialyzer, it filters the metabolic waste products from the blood and returns the purified blood to the person again. So the total amount of fluid returned can be adjusted. So typically hemodialysis is undergone at a dialysis center. So dialysate is a solution which is used by the dialyzer. It is a solution which is used by the dialyzer. Then we have studied about what a dialyzer is. So dirty blood enters the dialyzer. Then the dialyzer comprises of membranes containing through which the blood flows, the dirty blood flows. Each membrane has tiny holes that the waste can move out of, but the important things like blood cells and proteins stay inside the membrane. So when you pump dialysate into the chamber, into the dialyzer, when this clean fluid, that is the dialysate, enters the dialyzer, and it surrounds each membrane, cleaning the blood as it travels up the dialyzer. So the clean blood is returned back to your body, and dirty fluid, that is the dialysate containing the waste from your blood, goes to the drain. So in hemodialysis, blood is allowed to flow a few ounces at a time through a special filter that removes waste and extra fluids. The clean blood is then returned back to the body, removing the harmful waste and extra salts and fluids. So it helps to control the blood pressure and keep the proper balance of the chemicals like potassium and sodium in the blood. So the advantages and disadvantages of hemodialysis is: advantages is hemodialysis is an effective treatment for those with end-stage renal diseases. However, hemodialysis alone will not provide a complete treatment for those with kidney failure. Diet and fluid restrictions, especially fluid restrictions like you have to limit the intake of foods containing potassium, phosphorus and sodium, and drinking limited water. But medicines may need to be taken to replace other functions of the kidneys, such as regulating blood pressure and stimulating production of red blood cells to prevent anemia. So they will have to travel, the patients who are undergoing hemodialysis, it will be done usually 3 times a week. So they have to travel to and fro. So advance notice to travel arrange from dialysis in a visiting dialysis center. So you have to take an advance booking or advance notice must be given to carry out this dialysis treatment. So these are the disadvantages and advantages of hemodialysis. So with this, I would like to end my presentation today.